Thank you to Erin Crebo of Wading River, an RN at Stony Brook University Hospital. Thank you to Alyssa Greco, a volunteer firefighter and EMT for the Plainview Fire Department, and also works the front lines as a nurse technician at White Plains Hospital. Thank you to Galia, a cardiovascular tech at Mount Sinai South Nassau Hospital in Oceanside. Thank you to Amanda from Huntington, who works at PetSmart and says she's making sure your furry family member gets what they need during this hard time. Thank you to Charlie from Islip Terrace, who works as a driver from Intimates. Are you an essential worker or know someone who is? Then we want to hear from you. All we need is the picture, the person's name, the village or town, and what that person does for a living. Every night, right here at 7, we will be thanking the people who have been on the front lines during this pandemic. Just go to the News 12 Facebook or Twitter page. Good evening, I'm Stone Grissom, and welcome to our live coronavirus pandemic special report. Tonight we have a doctor from North Shore University Hospital to help you sort through what's going on with COVID-19 in our communities and across the region. And as every night, we want to hear from you. This is a call-in show, so call us, 516-393-1800. Well, today, Governor Cuomo announced Long Island is making great progress. His words, he said at the peak, the island was losing about 100 lives daily to COVID-19. That number has now dropped to about 13 per day. Cuomo also said the state is launching a pilot program to let visitors back in specific hospitals across the state. That includes 2 right here, Huntington and Plainview. Now, under the program, slated to start next Tuesday, visitors have to wear personal protective equipment, including masks, and will be subject to temperature checks. Now, the total number of New Yorkers who tested positive for the coronavirus, that is now almost 353,000. That is since the outbreak began. Long Islanders account for more than 77,000 of those infected. Again, that is the end of February, beginning of March right there. Now, in order to get the green light to officially reopen, Long Island still needs to meet 2 more of the state's 7 metrics required. Now, the statewide death toll, these numbers are just hard to even fathom right now. 22,800, more than that, almost 23,000. Nassau Executive Curran said only a handful with the virus were hospitalized yesterday. And Suffolk Executive Malone reports coronavirus hospitalizations are below 500. That's the first time since the end of March. Now, the coronavirus has claimed the lives of more than 3,800 Long Islanders. It's just tough to swallow. That's not very long of a time. All right, let's get right to our conversation. Joining us tonight, Dr. Annamaria Iakovou is a pulmonologist and critical care physician at North Shore University Hospital and a faculty member at the Zucker School of Medicine at Hofstra. Appreciate your time. Thank you so much for all you do. You're one of the heroes on the front line, so thank you very much. Let me ask you, how are you holding up and how are your colleagues holding up?
Thank you for having me on. We're hanging in there. We're doing well. Day by day, things seem to be getting better, and we're starting to see more of our intensive care units consolidate, more patients going home. So that's a good thing.
Now, are you still above capacity in North Shore University Hospital, or you've gotten below capacity?
I think we're below capacity at this. No, I know that we are below capacity at this point. So things are trending in the positive direction.
Okay, that's good news. Let's get some of the questions in right now. Janine from Ronkonkoma. Janine, you there?
Yes, hi, how are you?
How are you? What's your question tonight?
Good. My question is, to donate plasma for antibodies, do your titers have to be at a certain level?
So that's a good question. I'm not quite sure what the actual titer cutoff would be. I think that what makes the most sense is, one, that you've recovered from the initial infection, of course, that you're not feeling sick anymore. Now we know that, based on the antibody testing, you do actually have antibodies present. And if you're in otherwise good health, I think it makes sense to reach out to either one of your local hospitals or to, I think the American Red Cross is also collecting plasma. So I don't know that the criteria is much stricter than that. I don't believe that there is a cutoff, but that could change. This is all very new.
Yeah. Good luck, Janine. How about Josephine from Cinema Riches?
Yes. Hi. Thank you for taking my phone call.
Mm-hmm.
My daughter works in the local hospital in ICU. She was tested for antibodies and came back positive that she had some. As far as we know, she did not have the virus at all. Can you just antibodies by being around it?
So high level of antibodies, but no symptoms.
But no symptoms, right? So the vast majority, the majority of people will most likely be asymptomatic and still may have been exposed and and developed antibodies. So I think that, and we'll see this, I think the more we start to test people and measure antibody levels and get more epidemiological data, you can have antibodies and not have felt sick. And I think we're going to be seeing that more and more.
Okay. Let's try to get DJ from Wanta in. DJ, you there?
I'm here. Thank you, doctor, for everything that you're doing. I just wanted to ask, are we attacking the same COVID-19 strands, or has it begun to mutate by any chance?
So that's a good question. So it has begun to mutate. The details of that I'm not quite sure, but there are different parts to the virus, of course. So there are more than one strain of it, and viruses do tend to mutate. There are multiple strains of coronavirus in general, and then this is one, more specific type that has emerged. So at this point, we do know that it has mutated. To what degree and how quickly it mutates, I'm not quite sure. I think it's just too early to know.
Mm-hmm. Now, my understanding is that there potentially hasn't been proven yet, but potentially there might be a European strain and an Asian strain the strain that might have come to different parts of the United States. Is there any evidence of that?
Right. So there were reports that there was like a strain A and a strain B. I don't know if they're two very distinct strains or there's just minor changes in the genetic makeup of the small mutations in the virus itself. But yes, there are more than one strain out there. Just trying to isolate exactly what it is or where it's from, it's hard to say.
And I assume that also would hinder the speed of how you do clinical trials if you have to isolate patients that potentially have different strains and see which medications and which vaccines potentially work on one patient versus another patient.
Correct. So that's the challenge of trying to get a hold of, to understand how a virus works. Because if we look at influenza virus, right, every year there's a lot of work around developing a vaccine that will hopefully cover that virus and protect people sufficiently. Same thing here. These viruses are very smart. They adapt very quickly, so they can mutate pretty quickly over the course of a season. So that does make it challenging, and that's why larger surveillance type studies that the CDC is doing, where they're collecting data on anyone who has been infected, and now with the antibody testing to see what type of antibodies they're making and all that kind of thing, you need more data like that across a population in order to see if you can develop a vaccine that will protect enough people.
All right. Let's go to Noreen in Franklin Square. Noreen?
Yes, thank you. Healthline recently reported a possible spread in restaurants in China through air conditioning units. Now, many of us will be heading back to office buildings in a few weeks. How likely do you think that it can be spread through air conditioner units?
Right. So that's a very good question, and I did see that study where it seems that there was one person who was dining in the restaurant in China and was asymptomatic and became sick a few days later. So she must have been contagious at that time, but asymptomatic. I still think that there's a pretty low likelihood of that occurring in an office setting. I mean, if we're all taking the appropriate precautions, right? So the same thing goes for whether it's any other cold or the flu, the hand washing, covering your sneezes and coughs, all that kind of thing, because in a sort of vented system or where there's air movement and the droplets can kind of move, if there's one infected person, other people can get infected as well. I don't know that it's the air conditioner system itself. It's just the fact that if anyone is in the office who's infected, whether they feel sick or not, they're, and we are in an enclosed space, you're at higher risk for becoming infected.
Yeah, and doctor, I read a recent study in a controlled environment, that if someone's talking loudly, the droplets can remain in the air for up to 8 minutes. Now, that's obviously without wearing a mask, right?
Right. If, talking loudly, or if you cough or sneeze, they can't stay in the air for up to 3 hours, but that's very dependent on a number of factors. At what point in the illness the patient is, how many viruses they're shedding at that time, and also heat, temperature, all that kind of thing can affect it.
Okay.
So a lot of variables.
Let's try to get Christine in from Valley Stream. Christine?
Yes, hello.
Yeah. How are you? What's your question?
I'm fine. Thank you so much. Has any information been documented on how long it takes taste to return? It's been 7 weeks for me, and I hope it's not a permanent thing.
For taste to return? So that's, I don't think we have that information yet. I highly doubt that it would be permanent. But I can't tell you how long. So even with other viruses, sometimes after you have a cold, it takes a while for your taste and your smell to come back. I think it could be variable. I doubt it's permanent, but I don't think we have any evidence of that just yet. We don't know yet.
At least 5 months, because that's all we know about the virus, right? Yes.
Exactly.
Right.
Exactly.
It's a novel virus for
it
everyone
is.
now. All right, we're going to take a real quick break. When we come back, we're going to have more expert advice on how to keep you and your family safe from the coronavirus. Remember, we want to hear from you, so call us with your questions. That number right there at the bottom of your screen, 516-393-1800. We'll be right back. Welcome back to our live coronavirus pandemic special report. Let's bring back in Dr. Annamaria Iakovou, a pulmonologist and critical care physician at North Shore University Hospital and a faculty member at the Zucker School of Medicine at Hofstra. Appreciate your time. Doctor, before we get back to the calls, let me ask you this. I've been watching how different universities are approaching or trying to approach the upcoming school year, the fall semester. Schools like Notre Dame are bringing students back early so that the semester will end before Thanksgiving, before the real cold weather. Other schools are starting late, I'm assuming, because they hope they have more understanding. Medically, is there a better approach to this?
It's still hard to say, because although most viruses typically most people get infected more frequently with viruses during the winter months. That's not to say that people are not going to be getting infected during the summer months as the temperature warms up. So I don't know that avoiding November versus coming in earlier really will make much of a difference. I think it's still too early to say. I think the concern is also co-infection with other things like the flu as you get into the winter months. But I'm not sure that either approach is really great. I think it's really just the social distancing, keeping things the way we've been kind of doing them and just readjusting our lives to it.
Yeah, I think it's just a big whoever has the best guess, I guess, at this point.
There's a lot of questions.
I don't know if is Edward still there, or is this Rebecca?
Hello.
Is this Edward?
Yes.
Thanks for your call, and what's your question tonight?
My question is, I'm an 85-year-old senior. I've been tested through CityMD. It was a blood test only. I want to find out how accurate the test is, for one. And they had told me, I guess we got twisted up. I think the girls said something about come back in 14 days, but I think that was in reference to if I was positive. Between me, I've seen 9/11, I've seen World War II start, I've seen the towers come down, and this is kind of surreal. More anxious about getting the test. I haven't had any symptoms for the last 4 months. And it came back negative test.
Okay,
so
I'm sorry. So what's your question tonight?
The question is,
how good is the blood test?
The question is, they mentioned to me that I should be tested every 14 days. I spoke to my family doctor. He says no.
So your question is whether 14 days is necessary?
Yes, and if the test was 100% accurate, or is there any deviation as far as being accurate?
Okay.
Right. So that's a great question. So in terms of whether it's a nasal swab or a blood test, there's different ways to look at it. So if a test comes back, if one of those tests come back positive, it's very highly likely that that is an accurate test result. But that's not your case. If a test comes back negative, it really depends on how suspicious you were for the infection to begin with. So if you're having symptoms and you get tested, the likelihood of a negative test actually being negative, actually it wouldn't quite make sense, right? But as you go along in it, a negative test makes sense that it's more negative. So the point being that if you're not having symptoms, or anyone who's not really having symptoms has a negative test, then I say that is sufficient. The flip side is if you have a positive test but no symptoms, but you still have to believe that positive test, if that makes sense.
Okay.
So I would not, in general, I don't think if you're not having symptoms, I wouldn't go get retested.
Okay. How about Rebecca from West Babylon? Rebecca?
Hi, this is Rebecca. My question is that my dad is 83, and he likes to go swimming at a local community center, and I wanted to know how much I should be worried about him being in a public pool with everybody switching doors and lockers and showers and things like that.
Yeah, that's a real concern. I think that while we're still trying to sort a lot of things out, I would be very careful with that, especially, that he's 83 and we're still trying to get a better handle on this. Not to say that the pool itself, transmission through water versus like what you said, the handles and the lockers and all of that. I think that's where it's hard to keep up with keeping that constantly clean and sanitized. So I would probably avoid that still for the foreseeable future. I know it's difficult, but that's something that I would actually avoid.
Okay, I'm going to paraphrase a question here. This is from Jim from Orient. He had, I think it's Guillain-Barré syndrome, is that right?
Mm-hmm.
He wants to know if he had it 4 years ago. So does that give him any type of immunity from this, or is there any evidence of that?
Not to my knowledge, no. So Guillain-Barré is a progressive muscular weakness that you can end up losing tone of your entire body, difficulty breathing, those types of things. In terms of it being related to coronavirus itself, not to my knowledge, because Guillain-Barré can be caused by a host of viruses and bacteria, actually.
Okay, and I'm trying to squeeze Mindy Lee's question in as well. She has a question about daycare and camp. Is it too soon medically for kids to be out congregating?
So I think once again, that's a really hard thing. I think that we would still have to reinforce some social distancing until we have better ideas as to what things are on a larger scale, epidemiologically, with these big surveillance studies that they're doing. So we'd have to be really careful with reopening, because one sick person can equal a whole, school full. So right. I think it's still too early.
Okay. Unfortunately, that's all the time we have. Thank you so much, Doctor, for everything you're doing on a daily basis. And thanks for coming on and giving us your insight tonight and your expertise. And thank you for watching. We'll be back tomorrow night at 7 o'clock. We'll see you then. Stay safe.